Welcome again to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry straight from the experts. I'm Jan, and every week I'm chatting to Dr. Clifford Yudelman, taking a deep dive into the world of dental care, and that's from a consumer's perspective. So whether you're looking to brighten that smile or protect your wallet, we've got you covered with practical advice and also the latest insights. So stick around as we uncover the secrets to maintaining both your dental health and also your finances. Today we present to you the ultimate guide to dental checkups with Dr. Yudelman. How are you, Doctor?
I'm good, thanks. How are you doing today?
I'm great, thank you. Nice to talk to you again. Today, talking about the ultimate guide to dental checkups. So, Doctor, why is prevention better than cure when it comes to dental health? And also, how does a routine dental check or checkup play a crucial role in this?
So, thanks for that question. So, regular checkups help us detect issues early and prevent them from becoming more serious. And because of the theme of our podcast, Save Your Money, Save Your Teeth, it's also more costly to treat if they are more serious. And then preventive care, such as cleanings and in some case fluoride treatments, maintain your oral health and avoid decay and gum disease. And the last one is establishing a routine with your dentist builds up a relationship that promotes proactive rather than reactive dental care. You know, if you go to your dentist regularly and you do get a problem, it's not as scary and they know your mouth. But if you only go every 3, 4, 5 years when you have a problem, then it's going to cost you more, and also you won't really know your dentist that well.
Okay, and how does having regular dental checkups save patients money in the long run? Can you maybe provide some examples of how early detection actually prevented more costly treatments?
Yes, I mean, in the case of early detection of cavities or gum disease, if we find a cavity very early, we might be able to give you preventive advice, dietary advice, show you how to keep the area clean. There are ways that we can actually arrest or stop cavities to prevent getting a filling. We did a whole podcast on fillings. We've also done one on gum disease. But if you find a cavity and it's small enough to be able to get a small filling, it's going to be less costly. If it's a larger cavity and it's already going into the nerve, then you're going to be looking at much more expensive things and extensive things like root canals, which we've spoken about, or in some cases even extractions. And then you've got a biologic cost, you've got a missing tooth, or maybe even the cost of an implant. So, a stitch in time saves 9 is the saying, and that's true also with dental. Identifying and addressing minor issues early on reduce the risk of developing complex problems, and preventive treatments such as regular cleanings, which we're going to talk about on next week's podcast, are much less costly than having major gum disease treatment, or as we were saying, root canals and crowns and things like that.
Doctor, how often should someone schedule a routine dental checkup to maintain optimal oral health and also prevent problems from arising?
So it's generally recommended to have a checkup every 6 months. Some people with very high risk factors may need to come in more frequently. At OptiSmile, that's fairly rare. It's more common for us to see patients on an annual basis. They may come in for a cleaning every 6 months, but if they've had all their treatment, if they needed treatment or they didn't need treatment last time, then we find often that a checkup every 12 months may be all that's needed, especially someone who doesn't have medical aid. There's no need to pay for a full dental checkup every 6 months, because not a lot can happen in 6 months, especially if it was all fixed up. And regular checkups allow for timely intervention and also tailored advice to maintain your oral health.
Okay, and what are the main components of a thorough initial dental examination, especially for patients who haven't visited a dentist in a long time?
So that's a great question, because that will vary from dentist to dentist. And I can speak from our example at OptiSmile and some other dentists that I know. We book at least an hour, sometimes up to an hour and a half. In some cases, we may have done a 20 or 30-minute free video consultation with a patient to discuss their problems. So you're probably wondering, what do we do in an hour or hour and a half? It includes checking the teeth, the gums, the soft tissues. We have diagnostic tools. We've spoken about x-rays to help us find problems that are not visible during the visual exam. And we go over someone's medical and dental history, and we ask people to rate certain things, like how white or yellow do you think your teeth are? How straight do you think your teeth are? How clean do you think your teeth are? We've got quite a different new patient questionnaire that helps people identify things that they might be concerned about themselves. The way I do it at OptiSmile, I use something called co-discovery. So after we've shown the patient around the practice, they come into my room and I don't lie them back right away. I spend anywhere from 10 to 20 minutes, sometimes even longer, talking to the patient. Then I'll take some photographs of the patient just smiling and then using retractors. At that point, I'll lie the patient down and we'll do some pictures inside the mouth using a mirror and a digital SLR, a big camera with a double flash that we take pictures top and bottom. And then while I'm uploading those onto the computer, my assistant will take x-ray and a panoramic x-ray for the patient, which I will then look at. If the patient has any problems that require us doing a CBCT or a 3D x-ray, I'll tell my assistant to go ahead and take that x-ray there and then at no extra charge. And then when the patient comes back in the room and sits side by side with me, we look at the x-rays and the photos together while my assistant makes notes. Now, at this point, I haven't even looked in the patient's mouth, but we're looking to see on the photos and the x-rays together. It's called co-discovery. We're discovering what's going on, what the patient might have told us they had sensitivity on the upper right, and then we focus on that area. And the patient can often see a broken filling or a cavity or a crack at the same time as myself. And with co-discovery then comes co-diagnosis, where we can start discussing different options, like what happens if you leave that cavity alone, or what happens if you just get a filling when maybe something more extensive is needed. So before I even look in the patient's mouth, they have a very good understanding of not only the problems, what's going on there, and they start owning the problems, they also start getting an idea of the different options. So I'm not just putting them in the chair and looking in there and saying you need 3 fillings, an extraction and a crown, make an appointment. It's a very important appointment for building up a relationship. I think a lot of modern dentists do it this way or similar. If you're in a practice, or if you find yourself in a practice that's purely, very budget or low cost, or it's medical aid, you may not get, an hour and a half and all of the x-rays and the photos. So yeah, that's a thorough initial dental exam.
Okay, and then doctor, what is the difference between a quick checkup where the dentist spends like only 5 to 10 minutes and then a more comprehensive examination? When is each type of checkup actually appropriate?
Oh, yeah, good. That goes on from the previous one. So the exam that I mentioned before, we obviously don't do that every 6 or 12 months. That's always just for a new patient who hasn't been in, or if we saw someone and they had a whole bunch of work done 5-6 years ago, and then they've gone and lived overseas and now come back, or perhaps gone elsewhere, or haven't. In many cases, people feel their teeth are in good shape and they don't come in for 3, 4, 5 years, which is actually quite common, believe it or not. Then we'll go through the whole initial exam again. But say you were just in 6 or 12 months ago and you've had your teeth all fixed and there's no ongoing problems, after the hygienist cleans your teeth, we'll just have a brief visual exam just to look at things that we had identified before that we wanted to keep an eye on. It's much shorter. In many cases, we don't even charge for it. If a patient in between visits has a little rough spot, or they want us to have a quick look at something and it's 5 or 10 minutes, it's just in and out, and it's not the same as an initial examination and co-discovery like we just discussed.
Any advice for patients who prepare for their dental checkups to ensure that they get the most out of their visit, doctor?
Well, yeah, if you haven't been brushing and flossing nicely, don't think you can book an appointment for Friday, and today's Monday, and between Monday and Friday you can go and start brushing and flossing like crazy, but your gums take a little bit longer than that to heal. So if you do want to fool the dentist into thinking that you've been good with your brushing and flossing, you need about 2 weeks, book 2 weeks ahead. But otherwise, don't change anything you're doing before you come in. If you haven't been brushing and flossing and you give it a good go, your teeth could look all red and puffy, and the dentist will know that you only just brushed properly that day or just bought a new toothbrush. So don't try and fool us. On the other hand, if you want to put your best foot forward, get stuck in about 2 weeks ahead, and your gums should look a lot better than they do now. And, sometimes patients forget about the fact that they got food that's getting stuck on the upper left or the lower right, or, oh, this tooth was sensitive. So make a list. You just put a list in your phone or on a piece of paper. Think about what you actually want from your dental visit. If you have got cosmetic concerns, ask your friends or your family what they think of your smile, so you can get some other opinions, so that it's not just the dentist offering their own advice. The dentist might look at you and say, oh, your teeth are so yellow, and meantime, it hasn't bothered you before. So I don't usually do that to patients. One should always, make sure the dentist got your updated medical history, especially any medication that you've been taking. And if you have been to another dentist recently, bringing your recent dental x-rays or dental records is very, very helpful, because sometimes we see fillings that don't look very good. And then we might say, oh, that filling looks old, it needs replacing. And meantime, maybe you got it done 2 months ago elsewhere. And then it's a bit embarrassing. Not that we want to cover up for what another dentist has done, but we could at least be a little bit more professional about saying that it looks like maybe that wasn't such a great job, without insulting the previous dentist.
So obviously these routine checkups help in identifying potential dental issues early. What would you say are the benefits of early intervention, doctor?
Yeah, so aside from some of the things I said earlier about less extensive and less costly treatments, just monitoring and improving your general oral health will contribute to overall well-being and can prevent other related health issues.
Okay. And what are some of the common concerns or questions that patients have about the cost and also necessity of regular checkups? How do you address these concerns?
So we touched on that in a previous podcast. Long-term savings of preventive care definitely make up for the cost of having your checkups, especially if you're just doing an annual checkup. If you find a problem, say you have a cracked filling and all it needs is another filling, and you're going to spend a couple of grand, a couple of $1,000, depending on where you go, maybe $1,000, 900 Rand, depends on the dentist, then you've paid for the cost of the examination there and then. But if you leave it for another year and under the crack you develop a cavity that goes into the nerve, then you at a point where you could spend 5 or 10 or more thousands on getting a root canal and a crown. So missing checkups or not getting them at least annually is going to cost you more in the long run.
What advice do you give patients after their checkup to maintain good oral health and also avoid more significant issues down the line?
So, of course, we're going to encourage consistent daily oral hygiene, such as brushing twice a day and flossing every night before you go to bed. We're going to talk about diet if we see erosion, people that are eating a lot of acidic foods, things that we've covered in our previous podcasts, limiting sugary snacks and the frequency of those things, or in the case of someone with gum disease, maybe recommending a medicated toothpaste to use in a specific way, and making them a checkup and a cleaning for their following appointment. Once you get into a routine, it's much easier. And also, if we know that a patient's going to come back in 6 or 12 months, we can monitor and keep an eye on things. But if we've got a patient that, we saw them 2 or 3 years ago and there were a few problems starting, and now they come back and they way worse and it led to extensive treatment, then we may be more aggressive in recommending other smaller things be treated, because we might not see them for another 3 years. But if it's somebody who's coming in regularly, you can just, you got a better idea of how fast or slowly things are getting worse, or in some cases getting better.
And Doctor, finally, how has modern dental technology improved the effectiveness and efficiency of routine checkups? And also, how does it contribute to preventative care?
Oh, that's a great question. We at OptiSmile, we're very big on all of our technology. Most of the patients at the examination get an intraoral scan with an iTero, a 3D scanner. The scanner has NIRI, near infrared imaging, and HD photos, and the scan is very high definition, and it does something called time lapse. So if someone's got some recession or erosion, or they've got wear on their teeth from grinding, it will superimpose today's scan with your scan from a year ago, and it does a sort of heat map, and it will show us if the gum is receding further or if you're wearing away your teeth further. These days, all of our x-rays are digital, and we run them through something called the AgnaCat, which is an AI software that helps us to find things that we might otherwise miss, that marks the x-rays with a red, not a red X, like a red tooth, and we click on the tooth and it points out, oh, have you seen this or have you seen that? Or patients that have a lot of cavities and they come in regularly, these are not modern dental technology, but there's new toothpaste and different things that patients can do. And also educating the patient. We take very high definition photos and we show the patient the actual problem. I mean, all of these technological things help the patient to understand and help them to get treatment when it's needed, and also help them to see how they can avoid treatment by doing preventive things.
And that wraps up today's episode of Save Your Money, Save Your Teeth. As always, a big thank you to you, Dr. Clifford Yudelman, for sharing your expertise with us.
Thank you, and thanks for having me on. And I look forward to speaking to you next week about dental cleanings.
Yes, looking forward to that. The power of professional cleanings next week. Don't miss it. Also remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. Don't forget to subscribe for more enlightening discussions, and join us again next week as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.